Has a doctor told you that you need to lose weight in order to qualify for that joint replacement surgery or some other type of surgical procedure? And are you ready to scream because it's so hard to lose weight when you can't exercise and you're in pain and you're constantly stressed out? Hang in there with me if you are relating to this, because for the next 5 weeks on this channel, every Monday we are going to be going through some different tips and ideas on weight loss for pain reduction. So if you haven't yet done so, make sure that you hit that subscribe button and the notification bell so that you are notified every week when we release this new content. Whether you're overweight or not, even if maybe you just think you'd like to lose that last 5 pounds, I promise that what we're about to share with you for the next 5 weeks, you're gonna find informative and useful and fun. So hang on, kids. My name is Dr. Brandy Lipscomb. I'm a naturopathic doctor, and in the naturopathic world, we have a principle called docere. Docere means doctor as teacher. And so I am here every Monday to share with you what I can to improve your health, to inspire you to greater health and feeling better. Nothing makes me happier. So today we are going to be looking at several of the conditions that really benefit from weight loss, and then which ones may not benefit so much from weight loss. Obesity is classified as having a BMI over 30, and you and I both know that there are certain body types that don't fit well into the BMI categories. You know, if you're a strength trainer and you can bench 350 pounds, maybe your BMI is not the most accurate indication of whether or not your weight is appropriate. But for most of us, the BMI calculator is a great tool, and to make it easy on you, I've put one in the links below so that you can calculate. You just enter your height, enter your weight, and boom, there's your BMI with a nice little graph. Are you underweight, normal, slightly overweight, or in the obese category? So let's take a look at some of the conditions that if someone is considered in that obese range, they really benefit a lot from losing even just a couple of pounds. According to the research, one of the #1 conditions that can be improved by weight loss is migraines. That's right, it surprised me too. Migraines? What? A meta-analysis at Harvard showed that obesity raised the risk of migraines by 27%. And the American Migraine Association states that obesity raises the risk of migraines by 50%. So somewhere between 27 to 50% increased risk of migraines if someone is classified as obese. And what's interesting is that there's some research done in Italy where they looked at the severity, duration, frequency of migraines, as well as the impact on someone's ability to function. And they found that even with moderate or minimal to moderate weight loss, just 5 to 9 pounds, made a big difference in improving all 4 parameters of headaches, with the severity of the headaches being the factor that improved the most. Condition #2 that improves with weight loss is arthritis. No surprise there that if your joints hurt and you weigh more than you should and you're putting more weight on them, whether it is osteoarthritis, psoriatic arthritis, or rheumatoid arthritis, every type of arthritis across the board can improve with some weight loss, especially if it's in your weight-bearing structures, your hips, your knees, and your ankles. Condition #3 that improves with weight loss is fibromyalgia. And a pilot study was done where they looked at women who were classified as obese, having that BMI over 30, and they showed that an average weight loss of 9 pounds was achieved with the lifestyle and diet recommendations that they made over a series of 12 weeks. And even with that 9 pounds of weight loss, the women reported less pain, better body image, and better quality of life, better ability to get out there and do their activities of daily living. If you are someone who has been diagnosed with fibromyalgia and your BMI is creeping up to 30 or more, it's a great idea. Why not? Let's start today. And #4 on the list is low back pain. The research is loaded with studies that show that weight loss can dramatically improve pain ratings for low back pain, as well as disability scores. When you search low back pain and weight loss on Google, you will come up with 516 million results. So do you think that there's a lot out there on weight loss and low back back pain? You bet there is. And the fifth condition that we're going to talk about that surprised me too is diabetic neuropathy. Now you think, how does the weight have an impact on the nerves? Well, the compression upon the nerves is one of the issues, and the inflammatory cytokines that we release from our adipose tissue and things like adiponectins, chemical mediators that are released into the bloodstream when the tissues are more obese, can negatively impact the neuropathy and the pain. So if you're struggling with diabetic neuropathy and you're considered in the obese range for your BMI, it might be a really good idea to follow along with us for the next few weeks and see what you can implement and get excited about doing for yourself. I promise it's going to be easier than you think. And work on making some of these positive changes to feeling better. And this is just a small list. You know, I went scouring the internet trying to find a painful condition that would not be improved by weight loss if someone was categorized as obese. And you know how many I came up with? 0. That's right. I couldn't find a single condition that if someone is considered obese wouldn't be improved by a little weight loss and getting that metabolism up and running again. Now, there are conditions, genetic conditions like Ehlers-Danlos syndrome, that are sometimes characterized by more weight loss than they are with weight gain. And so if that is a condition that you're struggling with, then maybe this doesn't apply to you, right? And there are all kinds of examples of really thin people out there who still have pain. So I'm not saying that obesity causes pain. I'm saying that there are things that we can do if someone is considered obese to reduce the inflammation in the bloodstream and get that body into a healthier, happier state. And what's really cool is that the Pain Eraser program and the dynamic neuromodulation devices that we use inside our program, they work to relieve pain and stimulate your body's ability to heal no matter what you weigh. So if you're someone who is struggling with knee pain or joint pain and you can't get that replacement because your surgeon says that you need to lose 20 pounds first and you're finding that really hard to do, stick with us for the next few weeks and make sure that you register for our webinar to learn about the Pain Eraser and Rapid Recovery program. It might be just the ticket, just the thing you've been looking for. So go to see more, and in the description below, it'll drop down and you'll see the link where you can register for the Pain Eraser and Rapid Recovery Program webinar to learn all about this amazing space age invention from Russia that helps stimulate your brain's ability to see your body and improves your body's ability to heal itself and reduce pain by releasing anti-inflammatory local neuropeptides at the areas that we treat. So super excited to share all of that with you today and everything that's coming in the next few weeks. If you like this topic, make sure that you leave a like on the video so that I know that I'm on the right track in supporting you and your health. And if you really like this video and you want to see a little bit about how we treat a knee that is bone on bone inside the Pain Eraser program, make sure you click on this video next. And if you'd like to learn a little bit about some of my other favorite modalities to help relieve pain and have longer lasting pain relief, you need to click on this video after that. So once again, thanks so much for watching, and we wish you optimal health, happiness, and pain freedom in all of your days. We will see you next time.